hello and welcome to Boston IVF Facebook Live. Um, and this is going to be a Q&A session, and I hope I answer your questions. My name is Stephen Bear, and let me just get out of this here. Sorry about that. My name is Stephen Bear. I'm one of the reproductive endocrinologists at Boston IVF. Joined Boston IVF back in 1998. My main office is in the Brookline, Chestnut Hill area. I do see patients down in the Providence area as well. And so this is good. I'm so happy to really be here to answer your questions. I'm also happy to be part of Boston IVF, and I absolutely love what I do. And part of the reasons why I do love it is we have an amazing team that we all work together to help you reach your goal, from the scientists to the nurses to the financial coordinators. We're here to help you get through this journey and help you build a family. Let me just see if there are any questions here. Not just yet. We could begin just talking about, one of the hot topics in infertility has to do with COVID. And now that we have the COVID vaccine available, the question comes up all the time with my patients: if I have the opportunity to get the COVID vaccine, should I do it? What do you think about it? Well, first of all, you look at back where we were in March, we really didn't have, we didn't even think the vaccine was even going to become available. And here we have it. It was developed very early, and many of us have the opportunity to get it. I encourage all my patients to get it. If they have the opportunity to get it before they start treatment, I really encourage them to do it. The American College of OBGYN has also recommended that pregnant patients be offered the vaccine as well. Because if you get that infection during pregnancy, it can be more serious infection to deal with. So I really encourage all my patients to consider it. Now let me just check here and see. Okay, so I have some questions here. And the first question was by Teresa. I'm sorry, I'm new with doing this, and she did bring up about the COVID vaccine. And like I said, I would encourage Teresa that you talk to the physician who treats you. And what I'm telling my patients is they should get the vaccine if they have the opportunity. If they're lower on the priority list, then maybe they can proceed with treatment. But I tell all of them that once it becomes available, is to talk to me, and I can talk to them about the timing of the vaccine. So I'm seeing I have Becca, thank you so much. I know I took care of you back years ago, and 3 sons. I'm so happy for you. I remember you well, and so great to hear from you. And Cassie, I hope you have some questions as well. So let's see what else we have. Well, this is a very good question by Rachel. And the question is, when doing IVF, what factors into doing a fresh day 3 transfer, a fresh day 5 transfer, or a frozen embryo transfer? It's a very question, and it's kind of a hot topic in our field. And so we do day 3 and day 5 transfers. And, our protocol is it has to do with the number of eggs that fertilize. And if we have less than 4 eggs that fertilize, we typically will go with the day 3. More than 4, then we like to move to a day 5. And the one advantage that a day 5 transfer provides you is it just gives you a few more days to actually observe the embryo. So you could have a nice embryo on day 3 that's 8 cells, and then it just stops its development. So if you have a good number, sometimes it's better to wait to day 5. Another hot issue is to whether to freeze all the embryos. And there have been a number of studies out there in which couples going through IVF, not necessarily doing the genetic testing, but they freeze all their embryos and then they come back with for a thaw cycle. And there are some reports that actually report a higher pregnancy rate using a previously frozen embryo. So we don't necessarily feel like that's standard of Boston IVF, but we're closely looking at the published reports, and we may change our protocol in years to come. This is a question by Mir, and the question is, any tips before and after a frozen embryo transfer? Well, I think it's important, as you go through this treatment, you don't want to change your life. You don't want to turn it upside down. You want to be responsible. You want to practice a healthy lifestyle. I would avoid alcohol during a thaw cycle. Obviously, smoking is a taboo, and most people don't do this. You want to be active. I think exercise is good as long as it's in moderation. Following the transfer, years ago, it's interesting that we used to recommend days of bed rest, thinking that that would help, and it was probably the worst thing that we told our patients. And now the studies are coming out. The sooner you're back to your normal routine, the better. It's not a bad idea on the day of the transfer to kind of take it easy to some degree, but the next day you need to get back to your normal routine and back to normal life. And Caitlin, she's asking about her husband who had COVID. I'm so sorry, Caitlin. I think what I would do is I know you've been tested, and if you've ever been exposed to COVID, it can take, I think, on average a week before you have a positive test. So if you're going to get tested, you want to do testing over a period of time. And I would look to your husband should work with his primary care about when he's thought no longer to be infectious. I think once you get the green light from that doctor and your culture is negative, then I think it's fine to proceed, attempting pregnancy or going down a treatment path. Here's another question about COVID. I think we already answered it. The question, though, is regard to the COVID vaccine, and this is by Lauren, is there concern about getting it mid-cycle, having a frozen embryo transfer between the first and second doses? I don't think anybody really knows. It's probably safe, but I think if your decision is to get the vaccine, it's probably better to do it before you go down the path of treatment. And you could get the vaccine 1 month and then go into a treatment cycle. I think maybe after you go through treatment, maybe hold off and talk to your doctor. Well, this is a very good question from Stacy. What are your thoughts on DHEA for reduced ovarian reserve? And there are studies out there, reports that if you take androgens, so DHEA is an androgen like testosterone, that it can potentially increase ovarian reserve. And I don't think it's clear in the data, and at Boston IVF, I'm one of the physicians that, like all of us, we're kind of evidence-based. We like to see that there's conclusive evidence before we recommend any treatment. I don't think it would hurt anything, but I can't be absolutely certain that it would be helpful. Here's some other questions about COVID vaccine. And if you have any, we have a wonderful, go to our website. We have a lot of information that we keep updated. And I would encourage you to really kind of, it's an evolving story. And so we can provide a good resource in really keeping you up to date, really in this ongoing issue.